Hi everyone. Hey guys. So as we're waiting for a few people to file in, we can just catch up. So today we're going to be talking about Ramadan, if you're more Arab or Middle East, and in South Asian countries we call it Ramazan. So if I'm speaking, my background is Pakistani, I'm going to end up saying Ramzan. And if you are confused or if you're unsure what I'm saying, it's the same as Ramadan. So we're going to be talking about breastfeeding and if you can breastfeed and continue to fast. This topic is something that's been, actually I'm very surprised. I was talking about it today on a meeting that I'm seeing more and more questions, and I think that's so fulfilling in many ways to see that the work that you do on social media, it does impact and educate families in so many different countries. So while we're waiting for a few people to join in, we'll give it a couple more minutes. I just wanted to let you guys know that I'm not an Islamic scholar. I'll probably give that disclaimer a few times during this, but I'm going to do my best to present the medical evidence, the physiologic evidence that we have and data that we have when you're making this decision. So hope you guys are having a good Tuesday. I'm still in my scrubs. It's been a busy day. So we took Asya to karate. I took Asya to karate, came back, made eggplant parmesan. We're going to be heading out of town this week, so did some packing for me and the girls. Showered, put them to bed, so they're both in bed now. Hence, I'm getting the chance to do this live. But yeah, so all right. So for those of you who are joining or are new followers, my name's Dr. Amna Husain. I'm a board-certified pediatrician. I'm also a lactation consultant. And I'm also a breastfeeding mother right now and a Muslim woman. So there are a lot of questions that I've received from women as we're approaching Ramadan, or Ramazan, as I mentioned earlier. And we're going to be talking about a few things in terms of health when it comes to nursing your child. I can't answer personal medical questions for you all here. I'll do my best to provide some guidance, but unfortunately I just can't provide personal medical advice. So for those of you who are not Muslim and are still choosing to join in, I really, really, really commend you and appreciate that. I think as much awareness as we can build about minority religions and religions around the world that are not like us, I think that's amazing that we can continue to add to our knowledge. So for those of you who don't know, Ramadan or Ramazan, so like I said, I'm going to likely say Ramzan a lot, is an important month in Islam. So during this month, a lot of people think that we don't eat at all for 30 days, and that's not the case at all. It's actually that you just don't eat from sunrise to sunset. So that can vary in terms of hours depending on what season it is. So in the winter, your fast might only be 12 hours, whereas in the summertime, it can be close to 16, 17, 18 hours. It really depends on the season you're in, where you live, in terms of how far from the equator. But it goes from sunrise to sunset, and yes, you absolutely can eat and drink after sunset. So the things that you usually try to abstain from during that month is not just eating and drinking, but it's also going to be activities that are like lying or stealing or anything that is more physical, worldly, and that would not be more spiritual. So this month is supposed to bring you more towards humility, bring you closer to God, allow you to focus less on the outward worldly activities. So no lying, stealing, gambling, sexual activity, anything like that at the time that you are fasting. Because instead, you should be focusing more on humility, focusing more on yourself, focusing more on trying to increase your connection to God. You should use that time to volunteer or read the Quran or do something for others. So there's other ways that you can really connect with God, connect with your religion. This is a time that maybe you'll say that I'm going to try to, read 10 pages of the Quran every day. And after 30 days of doing that, that habit would hopefully stick. So it's a nice way to really try to get in touch more with your spirituality, which I love about this. You should try not to raise your voice. You should try to be, extra generous if you can with charity and with your wealth at that time, with your time. So it's a really good time to sort of reset if you find yourself losing your temper a lot. So it's more than just, I'm not going to eat or drink. So I wanted to give that background to anybody who is not Muslim and wanted to learn a little bit more. Now, interestingly, you might be like, well, why is it at different times? Which is very confusing, right? Christmas always falls around the same time. Yom Kippur often falls around the same time of the year. Why does Ramadan fall at different times? Well, because it goes by the lunar calendar, and that moves up about 10 days from our Georgian calendar. I hope I said that right. So every year it moves up 10 days. So this year it's almost all of April, but next year I imagine it's going to start March 20th or 21st and then, end sort of April 20th or 21st. And that's kind of how you see it over time being at different times of the year. So not just the summer, but also in the winter. So the main purpose of fasting, and I have my notes here for everybody who might see me looking away. Again, I'm usually pretty good on speaking on camera, but this is a really important topic, and I want to make sure that I get my words right when I'm speaking to you all, because I'm not an Islamic scholar. I'm a physician. Like I said, I'm a pediatrician. I'm a lactation consultant, but my words here are being offered as the general medical advice that we know and what we know about fasting and breastfeeding. But if you choose to save this and come back to it a few years from now, or if you choose to share this with other friends in different countries, I want to try to be as politically correct and consistent as I can. And so that's why I do have my notes here to make sure that I'm trying to hit all the important points. So as I mentioned, the purpose of fasting is to more, attain righteousness, both inwardly, outwardly, trying to abstain from sinful deeds, things that would hopefully, not make you as pious as you should be. So you're trying to abstain from those activities. You're trying to become closer to God during this time. And fasting in that point and purpose is more of a deeply spiritual practice for that standpoint. It's meant to benefit the body, the mind, and the heart. Because again, while you're fasting, you're not doing things like lying, raising your voice, all of those items. But let's talk about who can be exempt. Because a lot of people, I remember always getting this question like, wow, well, won't you get really hungry? What if you have a headache? Or what if you're sick? Well, the great thing about our religion, Islam, that I know that there's a lot of Muslims tuning in right now who are listening, but for those of you who are not Muslim, the great thing about our religion is it really does take care of others. So if you're elderly, you don't have to fast, right? If you're a 90-plus-year-old person, 80-plus-year-old person, or you have health problems, you don't even have to be elderly. Maybe you're in your 40s or 50s and you have diabetes. You don't have to fast. People who are pregnant should not fast. And I'll repeat that throughout this live because I got that question a lot. People who are pregnant should not fast. They should not fast because it is not safe for them and it is not safe for the baby, the growing baby. When women are on their menstrual cycle, they should not fast at that time. People who are ill. So if you're ill, if you're having the stomach virus, okay, or if you have the flu, or if you have a terrible migraine, or if you are as ill as you are on chemotherapy. So there is a wide range of how ill. You don't have to fast. And if you're traveling, you don't have to fast. And I think that that's really important because there's a variation of opinion among some Islamic scholars regarding what constitutes exemption within those groups. So for instance, what it means to travel and how far differs for different scholars. Obviously, when Islamic laws were established, traveling was something very different. It was on camels with caravans for days on end. Now it's you book a flight and you might be somewhere within an hour. Still, there are controversies. So some people are like, well, no, I don't mind traveling and keeping a fast, no big deal. But other schools of thought say, hey, if the exemption is there, you should respect the exemption. So it's there for a reason. And I respect both schools of thought. Again, it's not for me to tell you when you should or should not fast if you're traveling. So I just wanted to make that clear. now nursing is going to be the main focus of this talk. So nursing as an exemption. So I'm going to read here what we call something called a hadith, or a saying from Prophet Muhammad. And he says, pregnant and breastfeeding mothers are exempt from fasting. So some cultures interpret this very generally, and they won't fast at all if breastfeeding. And in other cases, and in particularly some Arab cultures, mothers will only miss those fasts in case of hardship. So if there are other turmoils going on in their life, that's when they'll miss it. And I think that that's really interesting, that some cultures really pride themselves on fasting through the most hardships that they can. And this is my opinion. This is not scripted or anything or from an Islamic scholar, but I try to remember that God doesn't force us to fast through hardship if we can't do so. It should be a spiritual activity, but if it's becoming unbearable for you or you're losing your way in this, then that's something that is between you and God. Not something that I'm going to discuss during this live, but I think that's interesting to point out that even though breastfeeding women are exempt, pregnant women are exempt, I still see that some pregnant women want to keep their fast. And I don't recommend that at all as a medical physician, at all. And suffering through that, there's no, in my opinion, bonus points that you would get from it. So I think that that's really important. Some women might choose to have their children very closely spaced together so that they can, try to, for example, if they're not going to fast 1 year because they're pregnant, the next year they're breastfeeding, the next year they're pregnant, the next year they might be choosing to breastfeed again. So that way, all of their children will have weaned sort of close to the same time, and then they can continue to fast as normal with the rest of their family. And some scholars, I think this is really important to say, is that how do you choose to make up those fasts? So you do have to make up the fasts that you don't keep. So if you're elderly, you would, there's different ways you can have a young man or young woman keep the fast for you. Or if you're sick, you have diabetes and you're unable to fast, what can you do? So you can either, for example, if you're pregnant or if you're on your menstrual cycle, let's say your menstrual cycle is 6 or 7 days and you choose to make up those 6 or 7 days, you can actually fast 6 or 7 days later and have the same intention that you are keeping these fasts for Ramadan. You can also, though, some scholars will also allow you to pay a compensation. So that compensation will go towards feeding poor people a meal for the number of missed fasts that you have. This is called fidya. And some of you may have heard of it, but that is also an option. Now, it's not for me to say like one over the other. That's something that you can reach out to your Islamic scholar for, your imam for. So for those of you who aren't aware, an imam is sort of like your local pastor, if you will, in a church. So we have a local imam in a mosque. So, for example, when I was pregnant last year, I did not fast. I reached out to the local imam and I asked for confirmation on what the compensation would be for the number of missed fasts that I would be having. And so that's fidya. And you can choose to pay that, and you can put that towards, there's charities online that you can choose to pay that towards those who are less fortunate for their meals. And again, that goes towards generosity, charity, giving, all of those things that Ramadan is supposed to represent for us Muslims. So one important factor, let's go back to nursing, when you're thinking of fasting, is the age of your baby. As I mentioned, you can absolutely be exempt from breastfeeding if exempt from fasting, if you're breastfeeding. Some women might say, I think I'm going to try it. And if I was your pediatrician, this is what I would say. So if your baby is still very young, less than 6 months, let's say, so complementary foods have not been introduced yet. So solid foods have not been introduced yet, let's say, I would strongly, strongly, strongly recommend against fasting because your child is completely potentially dependent on breast milk. And by fasting, you could definitely experience a decrease in your supply, a significant decrease. Now, this is very different than a child who is let's say over 1 year of age. Let's say they're 15 months of age and they're fasting and they're nursing once a day, and the rest of the day they drink milk and drink water and eat meals. I think that's a very different standpoint. And I think that that's between you and God. But if you choose to fast as a medical professional, as the child's pediatrician, I wouldn't have a big argument with that, because the child's really not dependent on you that much. They're only really nursing for discomfort maybe, or maybe only just coming to you for comfort. So I think that's really important to point out as well. So if you do choose to fast, you can, depending on how old your child is. So one really important thing I think to point out is that women who do have babies less than 6 months of age, or they live in hot climates, let's say, or you are potentially living through hardships, low socioeconomic status, low income, or you're tandem nursing, so you're nursing more than one child, or you have multiple children, so twins, let's say, or triplets, or perhaps you're at risk of severe dehydration for a medical disorder. You probably should not fast until you've weaned. Again, I'm here to provide the medical aspect of it. There can be people in the comments who may not agree, but that would be my standpoint as the pediatrician. The same goes for women who have a low milk supply, a confirmed low milk supply, or they must supplement and their child is exclusively dependent on all of their milk supply. If your child's a preemie or underweight, and usually that's going to be, again, those children who are less than 6 months of age, or you are ill or take medications that would make it difficult to breastfeed. Those are all appropriate exemptions as a breastfeeding mother. Now, I find that a lot of women, again, there's an uphill culture that even though I'm saying this, they think, well, I'm going to continue to fast through hardship because that's just going to make my fast count extra more. And I'm not here to say yes or no to that, but I will say that if there's a woman in front of me and she is really, really, really bent on wanting to fast, I would tell her to consider doing a partial fast. And that would be maybe 2 or 3 days a week. A partial fast is not fasting and then opening your fast at 1 o'clock or 2 o'clock in the afternoon. And I use the word open. So I'll tell you that I'm big on semantics when it comes to fasting. So opening your fast is opening it at the scheduled time. Breaking your fast is actually breaking it at the unscheduled time. So in this case, if you break your fast at 1 or 2 o'clock, that's not a partial fast. That's not a fast. That doesn't get counted, unfortunately. So instead, if you choose to fast, you can do a partial fast where you're fasting 2 or 3 days of the week, but you're still keeping that full fast for the 2 or 3 days. So I, for example, did this when I was in medical school, in my 3rd going on 4th year. I had to study for an exam, and most of my studying was obviously more beneficial when I was able to eat. And so I tried to really pack in my hardest topics on the days that I was not fasting. And my days that I did try to fast, like 2 or 3 days a week, I tried to take it a little lighter on myself in terms of what I would expect myself to retain and do well with. So you can always do that. You will have to make up those fasts or pay fidya, but that's an option if you are really intent on wanting to fast. But please remember, breastfeeding mothers are exempt from fasting in Ramadan. They can be made up at a later date. So when it comes to breastfeeding your baby during the first few years, obviously we know it's crucial time, especially in the very beginning, because it's not to say that you can't relactate. That's not to say that. But it's definitely a really important time where you want to try to sync your supply to baby's needs. So that's why we say don't watch the clock, watch your baby, try to bring baby to breast anytime they're showing you those signs of rooting or fingers to the mouth or looking around. So I recommend that it's better to fast at a later date, especially if your child is less than 6 months of age. Concentrate your efforts on the well-being of yourself and the well-being of your baby. If you choose not to fast, please know that it's truly legitimate. It's not taking necessarily the easy way out. Any Islamic imam would tell you that. And remember, there's so many other ways to seek the rewards of Ramadan. So time can even that you spend breastfeeding, you can read the Quran on your phone, or you can say prayers aloud to you and your baby, or there's so many different things that you can do. You can do tasbih, you can spend some time trying to volunteer, give extra to charity that month. There's so many different things that you can do. Now, here's the controversy when it comes to fasting as well. As I've said about travel, that some people think that once the rule is set, the rule is set. Some people say, well, no, I could do it anyway. So some Muslim scholars believe that women who are breastfeeding have permission not to fast. And some even say that it's wrong to ignore this act of kindness by fasting when you don't have to. So I think that's really important because I know I'm going to likely get comments about this later from people and messages as well. I'm not here to make the decision for you, just to present the data, and I see both sides of the coin. When a bounty or I guess the best way to put it would be a simpler solution has been offered to you and to reject it, I can see that some would say that it would be wrong to reject that act of kindness from God. So when it comes to if you choose to breastfeed while you are nursing, if you choose to breastfeed while you are fasting, one thing that we do know is the weight gain and growth rate of breastfed older babies does not seem to be affected by women who are nursing. So this is interesting, especially during the long summer fasts, because it can be really difficult for moms to cope with the demands of breastfeeding of an 18-hour fast. And so that exemption is there from God if you choose it. But just know that we do have some data that if a child is older, we're talking older than usually 1 year of age, their growth will not be affected if the mother chooses to fast. Because again, they're not really relying on breast milk for the sustenance at that time. It's more for comfort. It's still for bonding. So that experience is still there. I do want to make this really important note though about micronutrients versus macronutrients. So I did see an article that it was a study actually done that Ramadan fasting has no impact whatsoever on the macronutrients. And macronutrients are protein, the carbohydrate, and the fat intake. But they can have some impact on the micronutrients. So micronutrients would be minerals like zinc, like magnesium, potassium, those things that are closely really linked to mom's lowered intake of the nutrients. And I thought that was really interesting. So these nutritional statuses of lactating women were affected when they fasted during Ramadan. All of the intakes except vitamin A, E, and C decreased during Ramadan. So for those reasons, again, you have some data that shows you that if you are why you should be exempt from fasting if you are, again, nursing and your child is especially under 6 months of age. I believe the study was only 21 women. So it's not a lot of women, but again, if you're able to get a study on 21 women while breastfeeding and fasting, I think that's a pretty nice study to be able to grasp some info from. So again, as a pediatrician, I can't make this decision for you, but just know that a child who is less than 6 months and exclusively breastfed has much more different needs than a child who's over 1 year of age and eats other foods or is maybe nursing from you at night. So if you're watching this and you see me and you're like, well, that's really great, but I don't know this doctor really well. So it might be helpful for you to discuss with your family and friends who fasted. Talk to your doctor or a breastfeeding specialist. Talk to an Islamic scholar. Talk to all of these people and don't base your decision off of one. So for example, even the Islamic scholar, he's not going to necessarily know the benefits of breastfeeding, for example, that the breastfeeding specialist will. The pediatrician will be able to guide you potentially on what to look for as warning signs if you choose to fast. But they may not understand why this is so important to you if they're not Muslim. So there's all these different angles to take a look from. Your family and friends might be like, yeah, I totally understand what you're going through right now in your life is probably not the easiest time for you to fast. The Islamic sheikh or imam may not completely understand your personal life. So there's all these different variable factors, and I think that you can take all of those into account. And if this live helps you, then even better. So when some women are deciding to fast, they may prefer to fast with their family instead of making it up later. And I think that if you are, again, your child is less than 6 months of age, please, please, please talk to your child's pediatrician, because I would recommend that mother make sure she stays cool, she stays hydrated, she watch her baby for signs that he or she is not getting enough milk. And the way you would understand that would be, so baby would be putting out less urine. You can also see that baby would be less active. You can see how well baby is producing tears. So if they have a wet tongue, saliva, for example, you can see by their sunken fontanelle, especially if they're very young. You can also check by their weight gain. So if you are choosing to, you can absolutely check in with your pediatrician and say, like, can I come in more frequently for a weight check? That is totally okay. You, again, don't need to make this happen through hardship. Remember, you don't have to fast through hardship. Now, when it comes to a few, distinct things, I wanted to hit on medications. So obviously, people wonder, how do medications work? So nothing that you can taste in your throat should be something you should take. So eye drops, ear drops, brushing your teeth, gargling, all of those things are okay. Usually I do recommend that, you obviously, if you have to take a tablet and then take a swig of water, you should not be taking those medications. But if you need to, then understand that your fast will have to be broken. Don't force yourself to do something if it doesn't feel good. So if you're diabetic, if you're on chemotherapy, you don't have to fast. You don't have to suffer through a fast. And of course, I don't know what suffering looks like to you or what suffering looks like to me. Sometimes I've had terrible migraines that I've had to break a fast for. And you might say, well, you couldn't tough it out through a migraine. Well, my suffering might look different than your suffering. And that's my decision and my personal relationship with God and yours. So you get to decide your threshold for suffering. Does that make sense? This topic, it can get a little dicey and it can get a little philosophical, but I think it's really important to mention those things. And I'll close out with my top 5 sort of tips that I recommend. But before I do that, I got a few questions. So one would be on intermittent fasting. So intermittent style of fasting, really, Ramadan was the ultimate, the OG of all of this. So you can usually, be able to intermittent fast without decreasing your supply, because intermittent fasting, it gives you a little bit larger of a window. So for example, your window of eating might still be during the day, so you can really pump all the water you want and you're nursing baby, it's totally fine. Versus with Ramadan, you are still not eating, but you're not eating during a very difficult window of time, like during the day. And at night you can eat, but at night you want to go to sleep. So that's, I'd say, the difference. Intermittent fasting has not been associated with decreasing your supply, and it's likely when the time of the fast occurs. The other thing I really wanted to mention. So, as I mentioned, there's 5 things that I'd recommend that if you are choosing to breastfeed. So some women might use this as a time to wean. I did that for my first. I had a very difficult journey where I was exclusively pumping, and I made the decision around 5.5 months that I was going to stop, and it really coincided with Ramadan. And I used that to really, super, I guess, charge my weaning process, because I had like no clogged ducts, and it really helped my supply drop very quickly. But again, I was making that decision to wean. So if you do, this is a great time that you can really bridge, if you wanted to, with pumped milk and formula if you wanted to. Totally your decision, but personal standpoint, that's what we do. We are right now combo feeding baby Mariam, so it's not a big deal from my standpoint. And if anybody has questions, I'm happy to share personally what I'm doing. But generally, that's the way I really feel, is that if you do choose to fast, I would recommend a couple of things. First, try to open your fast with energetic foods. So at your scheduled time, when you're opening your fast, obviously we would open it with dates. If you're Muslim, you know that we usually open it with dates. It's a high carbohydrate food, good amount of sugars in it. And so it does really help. Initially, it's a high energetic food, but really start chugging the water, okay? This is not the time to get into like the juices and all those different things, the fancy drinks. Just focus on water. And on that note, so my first tip is keep a food diary, because you're going to want to make sure you're eating and drinking enough if you are fasting and trying to nurse. Again, this is aimed at women who have children over 6 months of age, if you do choose to fast. But remember, a breastfeeding woman is exempt from fasting. 2, my biggest tip would be take a multivitamin. I always recommend that a fasting woman, in fasting, you should take a multivitamin, but I also recommend that if you're breastfeeding, you should take a multivitamin. So definitely, I would recommend, even if you're not nursing, vitamin deficiencies can occur during Ramadan. So definitely try to take a multivitamin. And 3rd, if your child is still waking up in the middle of the night to nurse, keep your water bottle by your bedside. It's midnight. Guess what? You don't have to fast. It's after sunset, but you're awake. Make sure you're keeping yourself hydrated during that window of time. You can even keep some food by you if you wanted to. But that's a great way to make sure that you are continuing to try to keep yourself hydrated during the hours that you can. All right, my 4th tip, because I'm sure you guys have all been where I am during suhoor or sehri, where it's very, very difficult to get yourself up to eat. A smoothie is a good option. A smoothie is a great way to add in high protein, good fat food. So you could do maybe something like whole fat or reduced fat Greek yogurt or milk, or add in vegetables and fruits and peanut butter or avocado, all these different ways that you can still add in protein, healthy fats, and be able to drink your calories in a healthy sort of way. So sugary drinks, not a great option. Smoothie, which you bulk up with real foods, probably a better option. And again, this is a great way to make sure you're hitting good nutrients and still trying to hit your hydration goals if you are nursing. All right, 5th, the post-iftar healthy snack. So please try to not snack too much on the bad items. So we all know that there's lots of feasts that go on during Ramadan, but that's not really going to be the thing that helps you when it comes to your supply. So you're going to want to try to focus on making sure that you're eating good, wholesome foods so that you can keep yourself healthy during this time to continue to nurse, if you do choose to and your child is over 6 months of age. So a couple of things I did want to mention in terms of, can you help your supply? So breast compressions can help. So that would be really trying to help augment your milk ejection reflex, which is already a little slower at the end of the day and is going to oftentimes get slower and by the stress of fasting. So breast compressions is something you can do, and it helps to really drain out the milk from the back of the breast as well. And the other thing would be, try not to skip feeds. So the more you continue to empty your breast, the more your breast will get the signal to create more milk. So again, try not to skip feeds. Now, a few questions that I had, and one in particular that I wanted to point out. So I've already mentioned about fasting during pregnancy. Big no-no. Please do not do it. Please don't do it. It's not beneficial to you or your baby to fast during that time because your baby needs you. Now, what about during IVF? I am not a fertility specialist. I would not recommend fasting during IVF. I would not. And I'm sure almost any IVF Muslim physician, doctor would agree with me in this case. You should try not to fast during this time because there are a lot of changes going on with the injections that you'll be giving as well. And generally, if you're undergoing procedures, etc., it's better to not fast. That's another thing. If you are going to be getting a procedure done during Ramadan, you should not fast that day. It's better not to. Again, you do not have to fast through a hardship. So I hope that was helpful. That was just 30 minutes or so. If you guys have any questions, you can feel free to comment them. I did see a few comments come in. I'm going to continue to save this live. You can absolutely come back and watch this later if you have any questions, or you can save it with others, or save it and share it with others. No problem whatsoever. But I hope you guys have a good night, and I hope this was helpful, and inshallah, Ramzan Mubarak.